Dear colleague and colleagues, all my dear B&B Dental family after 20 years, first of all, thank you for inviting me to be part of this very big event, a very important event for all of us. Dear Captain Claudio, I don't see you. Claudio? Claudio? Okay. Dear Captain Claudio, I see that you have new sailors, digital sailors on your boat, like Dr. Elle, and I hope so in the future you'll have very nice ship and very good sea on this ship digitalization and your future in the B&B Dental Company. Very nice organization till now, and I wish you all best from my name and name all from the colleagues from the Bosnia and Herzegovina. Let's go speak. Okay, the partnership between dentist and a dental company is very important. All of you are from some kind of the dental offices. For example, in my practice, I don't mind who is the CEO of the company who produced impression material. Okay, I'm not interested about who is the CEO about company who produced gloves. No, but I'm very interested about this. Who is the CEO, who is the manager, and who is Dr. Zaella in all this pyramid in the implant company. It's very important to have partner relationship between you and your implant company. Basically, implant company must feel of your pulse, and you must feel the pulse of this company to have good future. This partnership is very important, and I can say that I have more than 20 years experience with the B&B Dental Company. This is very old X-ray, AC X-ray it's analog X-ray. We make a picture, and today we have CBCT scan. This implant put 15 years ago. If you see now in this CBCT scan, everything looked perfectly well. There is no signs of the bone resorption. Emergence profile, it's okay. The crown is okay, which means this works. I will start in some 19s, end of the 19s. My first education was in one town in Germany, Kiel. In this time, I have experience with Frialit 2 system, Frialit 2. It's something like a tibian implant, but all the guy know this. When I use with this implant, I say, oh my God, it's too complicated. There's too many pieces. Too many different platforms, too many healing abutments. And I say, oh my God, I hope so. In the future, I will need something simpler. Yes, I meet this guy. This is too dynamic picture of the Dr. Claudio, but it's very hard to find slow down picture of Claudio because he's young, like he have 18 years. This guy showed me that some things can be simpler. Like Albert Einstein say, everything should be made as simple as possible, but not simple to death. It's strategy of the Dr. Claudio. He always go with the time, sometimes goes a little bit faster than time. Now I see it with the CPCT guided implantology, and we'll speak about that. After my experience, I was part of the team. Here is the team of my department. We have some lectures in Balkan Congress in Belgrade, and I explained that I saw a very simple system. I explained the system I think is nostalgic view of this old packaging of AC implants. I explained that this system works. We explained that this system works and it's very easy to make about an even custom made. When I first time see this, if you see these implants, you think there's no cover screw inside and there's nothing inside. There's no gingiva formers. And first time in my life, I saw the gingiva formers for the Teflon. And I asked myself, Claudio, what is this? But now we have gingiva formers for the PEEK material. Believe me, it's better than titanium. If you see, after a couple of weeks, the PEEK material in mouth, the level of the tartar and the calculus is low. It's a very good solution. We start even with the external hex in the aesthetic region. I will show you one old cases. Old, very old, like you see in this picture. And we have, basically with external hacks, very good aesthetic results. After that, there's evolution in the 3P. 3P is a system like you have all-season tires. Or if you buy SUV vehicle, you can go to your kids to the school. After that, you go in a mountain to the skiing. And after that, you can go to the highway to the drive. 3P system, it's very bone friendly. In compact bone, in spongious bone, even in all 4 classes of the bone, it's very bone friendly. But you must know the protocol of the drilling is not same. Like you see, you have triple apex groove. It's perfectly anatomically designed. You have good macromorphology and very good primary high stability. There are 2 things state of art now, not before with EC. You have state-of-art surface treatment and state-of-art cleaning treatment. Surface treatment is double acid treatment, and state-of-art cleaning treatment is argon plasma treatment. Sorry. Okay. Connexa, beautiful. Connexa is the solution that you have basically 2 geometry, and it's very important to have good connection. When you put the abutment, after that it's impossible to put him out without unscrewing. I'm in love in this system, and the system is very safe. If you saw some other companies, you will see that you have many color-coded gingiva-formers, color-coded cover screws, color-coded abutments. That can make confuse in your practice, and that can make confuse in your laboratory. In a 3P system, you have a regular platform for all of the dimensions of the implant except a slim implant, I think 3.0 and 3.4, but basically you feel very relaxed. You have one platform, your technician is not confused, you are not confused, you can solve all problems. During the evolution of the system, we introduced evolution system. Sometimes I think it's not my cup of tea, but it's very good to the post-operative extraction and give us the high level of the primary stability because this innovative design. You can see one of my cases, it's post-extraction, immediately loading. Now we have definitely crown on evolution system. Diameter 3.0, very interesting. I think Professor Lazic today will speak about implantology in the aesthetic region. When I was younger, I think the big implant, better result. No. Now, I think like this. More bone, less titanium. 3.0, it's very indicative for the lateral incisors, for example, for the frontal teeth in lower jaw, and if you have anodontion of the lateral incisor, what is aggravating circumstances? First, bone is slim. Second, if you have orthodontic movement of the roots around, periodontal space are very difficult. If you go very close with your implant to that periodontal space, you will have loose implant, even the tooth. 3.0, it's very applicative, and I use him. If you see in this CBCT scan, everything looks great with 3.0. Slim, but strong. 3.5, and bone spreading. When I say to you that Claudio Banzi, founder, is a guy who have brain to thinking, he think also tools. We have tools we can make bone spreading technique. If you see this case, okay, if you see this bone, what we can do? We have quite bone enough to the alar ridge, but in upper region, we have slim bone. We have only 2 possibilities. One possibility to make bone augmentation, and other possibility to make bone spreading. If you look this set, you will see compactors. Beautiful for the spongiosa, beautiful for the bone who is soft, and if you know this, you can make result like this. You see? You see? You see? Okay, no bone augmentation. But during this procedure, you must listen to the bone. It's very important to have feeling. Okay, I finished this job. I was less traumatic extraction because atraumatic is impossible. I put the implant, enucleation of the cyst, I put the augmentation, I put the membrane, I sutures, and I put the gloves down. My job is not finished. My problem are not finished in this moment. When I put these gloves, maybe some potential problems start in this moment, because I think about next 4 months about osseointegration. I think about what will happen with emergence profile anesthetic. I think about what will happen in a recall control after 4-5 years. Walnuts fruits wait for 5 to 10 years. I don't like to see X-rays on the Congress from yesterday. Please, show me a picture from before 10 years, and I will say to you, it's everything okay. This is 15 years later, and I can say that some things are good. I will show you some X-rays, because X-rays, especially 3D, it's only true. Don't show me some smiles, don't show me some women like mannequins models. No, I like the X-rays model. This is aesthetic functional result after 8 years with the 3P. Mini implant. Wow. Mini implant is very interesting. Basically, sometimes mini implant can help you to have final result. All of you have experience. Ask yourself, why is this position of the mini implant? This patient have 86 years old. We removed the bridge with a big defect here, big defect here. You can see foramen mentale, you can see mandibular nerve, only one of the island of the bone I have here. Did I make augmentation to a patient with 86 years? No. I put 2 mini implants, make stabilize over the enter, and after that we put more implants to have a better solution in the future. Some case 12 years old. After that, we go with sinus lift procedure in the right. Left, we don't want sinus lift. Why? To avoid this mucocellular cyst in the maxillary sinus. Sometimes can jeopardize your sinus lift procedure. During this, we use this safety implant membrane from the Duravit, who is make stabilization of the implant, especially if you have low the 2 millimeters of primer bone, because sometimes this patient have overdentures like temporarily, and sometimes overdentures can move this implant. We need stabilization. Okay, this is 10 years after. Bars. I'm basically in love in bars. You don't want, but I love it. Especially in the bars in external hex. Today, still, I make dental implantology with the external hex. Very low level of the bone resorption. If you look better, what is external hex? It's multi-unit abutment in one piece. Lower jaw, also result, aesthetic result, and finally CBCT guided surgery. Okay, when we speak about CBCT guided surgery, we must think about our fathers. We must think who is the father of the CBCT also. Sir Godfrey Hounsfield in 1967 promoted first multi-slice CT. In 1976, I think he took Nobel Prize for this. CBCT first was introduced in 1996 in Europe and 2001 in the United States. Today, it's one of the most favorite tools in my practice. CBCT guided surgery was introduced last decades. Everything is good. Patient ask about it, professional ask about it. Okay, let's speak about it. If you want to speak about something, you must have both sides of the story. If you go Google it and go to the website of some company, B&B Dental, you will see professionals, patient, professionals, patient. Let's look both sides of the story. From the patient side of the story, everything looks like a tale. Decreased treatment time, yes, it's true. Less invasive surgical procedure, yes, it's true. Faster healing time, yes, it's true. Improve precision and predictability, yes, it's true. And option on same-day prosthetic, yes, it's true. But from the professional side, let's speak honestly. Decreased waiting time? No. CBCT guided surgery decreased only surgical time, but you have so much job about it. Think about it. Like, we speak about it. Faster healing time. Yes, it's true. But if you ask me, for me, it's more important final outcome of this patient than some post-operative sequela like swallowing or pain, especially we are surgeons, you know. Improve precision and predictability. Precision and accuracy, it's not the same thing. And we will speak about this today. An option of provisional ophthalmology. Last but not least, for me, it's decreased of the bone resorption during the flap surgery. There are so many articles for 18 years say to us, if you have full flap, after that it's strong osteoclast activity. We have bone resorption. With the flapless surgery, we reduced bone resorption. From my point of view, it's one of the best things. Is CBCT guide surgery easier? No, it's more accuracy. Guide surgery needs additional time for this. Look, taking impression, walks up, combing 1, combing 2, optical scan, importing the image, the matching on the image, it's a job. I like numbers and I like articles. I don't like lectures without articles, believe me. This is true. This is evaluation of different errors, you see, angular, coronal, and apical during the guided surgery. This is true. When you speak about accuracy and precise, basically you can be precise but not accurate. There are so many combinations in your practice. You can be not accurate and not precise. You can be accurate but not precise. You can be not accurate and precise. And finally, only one result we need, accurate and precise. Tarbesh, in 2012, explained us how we have accuracy from left to the right, 3 different types of the guided stent, mucosa supported, bone supported, and tooth supported. This guy, I know something about bolts. This guy make measurement of the ring. This is big bolt because this is big anchor. CBCT guide surgery, it's rings of the procedure. And all rings must be precise if you want to have accuracy result. First ring is CBCT device. I don't know how much of you have your CBCT in practice, but when you ask yourself, when you make calibration of this device must be high calibrated, must be high precise. During making the CBCT scan in my practice, my assistant, we have special room with the music, with the LED pictures, artistic. My assistant put the patient, and after that we do this. Close light down, look in the picture, and don't movement. It's very important. It's first ring of the accuracy. Second ring of accuracy is scanning. We speak about 2 ways of scanning, intraoral scans and the scan of the plaster, the models. Intraoral scanner make cross-stitching. Sometimes you can have problem with this. It's not so easy like you look on the YouTube, especially if you work in-house like me. Next is playing software. Sometimes it will look like joke, but it's easy to play with your mouse, put everything on display. This patient have a Medline bridge, and we make PC reconstruction before we make implantology. But without guide model, it's possible to use from library different implant system. Okay, this is before, this is after. But you must have very precise in aesthetic region. It's not for the people without experience. And we have printing. There are 2 types, printing or milling. Question is how old you make for your 3D printer calibration. Calibration of the 3D printer is also very important. 5, it's very interesting. Implant surgery cross to the stent. What is potential problem with this? Okay, Sometimes you can have stent mobility during the procedure. Sometimes you can have a crack of the stent. You must think about a range of the open mouth of the patient. Dr. Claudio Banzi solved this problem. I'll speak about that. But patient with a limited open mouth, with a long burst, you can have big problem during the surgery procedure. And consider about irrigation of the bone. Some stents cut possibility of irrigation. If you can use some tubes around to make internal irrigation, is best for you. There one very interesting article from Greece. I Googled this guy, he's so young, I understand him. He make some cadaver experiment, non-radiological analysis, and conclusion this. CBCT guided surgery may help unexperienced clinicians to place implant with high accuracy. Please. CBCT guided implant sometimes can be very dangerous tool in the hands of people without so much experience. My advice, took your cases for the start. Take mandibular with big bone, take upper premolar, take your clinical mentor with you to help you for the start, but don't go in the aesthetic region. In our practice, we use in-house scanning, printing. We can use in 1.5 hours, we can have stent. For this method, you need high training. Accuracy is not so high level like centralized. No, but you can have it in-house. This is very good for the people who have less than 100 implants years and who don't have experience. This centralized digital workflow. But you must take impression before. Think about impression. No alginate, no bubbles, no. Take very high, good, precise impression. After that, put the template with the radiographic markers, okay? After that, make good CBCT with very good calibrate device and send to Italy. You have back the stent and your accuracy will be high level. What is inventive in my friend Claudio? The PIC sleeves, self-lubricate sleeves. Temperature of these sleeves is low level than metal sleeves, and he solved this problem with lateral opening, and you can solve this problem with the patient who have limited range opening of the mouth. This software is very friendly use, very good and easy to handle with. Implantology, aesthetic region, please. It's special field. Think twice. Do you want to go to the implant for the start in the aesthetic region? You must know something about the bone. You must know something about how healing bone and bone resorption. And you must know true. This is very rare situation to have vestibular and palatal bone. This indication for extraction is Saturday night fever. That was fight and tooth avulsion. I dream about patients like this. To have vestibular palatal, it's our sweet dream. We need to have intact wall sockets, and it's, in more cases, our sweet dream. The main cause of the tooth extraction have a big impact to the extraction scenario. Extraction scenario is very important to you planning the surgery in this day. This lady I will call it devil scenario. He have tooth avulsion 15 years before, he make replantation. After that, she have root fracture, and in one root, you can see 3 different modality of the healing. Ankylosis, internal resorption, and infection, without any bone. It's very hard to put this tooth out. You don't have vestibular lamella, in this case, and palatal also, and we must make augmentation. Vestibular, palatal, titanium mesh membrane, it's very hard solution. Planning is very important, especially planning if you have bone augmentation. Look to the Hounsfield units, how bone in density, and sometimes you can choose which type of the implant you use. Check out after the CBCT after surgery. That would be fine. That would be fine. 2D, no. 3D is true. Image 2D looks like this. In 3D looks like this. And some pictures can be phony, like this fish. Think about planning. I saw so many cases that young doctors think about bone, about lamella, about how to put implant, but didn't see intercuspidation. Didn't see wood. In wood, didn't see tree. Intercuspidation is very important. If you have a bad planning, you can have this result. You have implant, but what with this? Beautiful. There are some modifications of the flat plate technique, socket shield technique, and I think my colleague will speak about this today, and I would like to discuss with you about this. I must tell you that this is basically not my cup of tea. There are some results about that, I believe, but what is basically way of thinking? During the extraction, leave one part of the root, okay, to prevent resorption of the vestibular alveolar, okay, put the implant, make augmentation, and you will have good result. Every time when I don't listen to my father, I make mistake. Father of implantology have a name, Brennemark. One of the definition of osseointegration is no interposition, not bony tissue between surface of the implant around bone. What can happen? This article from 2 years before showed us in 128 cases, they have survival rate 96.1. Results look not so good, not so bad. But what you have in the future, 17 complications. One of the complications is potential migration. Why? When you extract the root, you say, okay, clinically, I see root is fine, root is fixed. How do you know how much fibers you cut during the procedure, during the vibration? Even you use ultrasonic extraction. How do you know? If you cut the fibers, after several times, this will migrate and you will lose vestibular lamella. This is implant position and direction. If we, in aesthetic region, implant two vestibular, we have this extension. Two palatinal, you have problem with the emergent profile. Mesiodistal incorrect, you can problem with papilla agonist. 1 millimeter of mistake can make a big problem with you in aesthetic region. And dentists without experience, please try simple cases for the start. Go slowly, take your consultant. Go with a good mandibula, go with a good maxilla. Don't think about this. The aesthetic region implantology is not guided implantology, it's guided prosthodontics. You can make abutment before you make the implantology. It's very high precise, it's very important for you. No want to have this in practice. Worst case scenario. The problems you have in guided surgery are cumulative and additive. And in the end of the day, you will see what was the problem in this ringer chain. Only if all rings are precise, we have accuracy. Without one ring, we are losing chain, and our both. Every new approach in the industry, I don't love on the first sight, needs time to evaluate. Contemporary lectures speaking about blah, 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 without any science. I'm in love in science. Let's see what's happened with the measurement. Science begins where the measurement begins. 2 years before, we have last year, we have a very nice article who systematically reviewed current dental literature regarding clinical accuracy of guided surgery. Look, future clinical research should use standardized measurement technique for important accuracy. Next, I think this guy from Italy, yes, 2 years before, doing same systematically review of the articles in single 1, 2 missing. There is need for standardized study comparing result in accuracy. This is not so big elephant surgery, but we make sinus lift right, sinus lift left. This is halognatopalatoschisis, a very hard, complicated case. This guy have underwood septa in sinus, can jeopardize sinus lift procedure. It's abutment, its final result. 1 overdenter go to the garbage. We are very happy. 9 years later, everything look fine with the B&B Dental implant. But when you speak about mouses and elephants, I believe in the meat in a mouse and elephant. Sometimes I have scared mouse. Sometimes I have scared to the fractura ad longitudinam in aesthetic region than some big surgery. I'm scared about late complication. You can have early complication after 2 months. No, lost implant, super. But if you have this scenario, after 1 year, problem to solve. Because you don't think about 2 millimeters bone, I suppose so, in this region, and we have exposed implant, very hard to solve it. This is typical franchise Italian restaurant. I think owner of this restaurant, smoking Cuba in Jamaica, he don't know names of the employers. He have know-how technique, but I don't like to eat in this kind of restaurant. This is typical Italian restaurant. You have always father here. Mother is around, think about economic and everything. You have sons, one sons, other sons who help and give the force father, and I'm in love to eat in restaurant like this. B&B Dental Company is family company with years of experience. B&B Dental Company offer high spectrum of the surgical solution, state-of-art surface, state-of-art connection system, and manipulation is very good. CBCT guided surgery need all rings in chain to be accurate. In future, there is need for standardized studies. When you speak about reading, I have one tip before I leave from here for younger. You say, with the reading, we get knowledge. With the working, we get experience. Leonardo da Vinci says the wisdom is the daughter of experience. But I say to younger, the tomato is the fruit, believe me, yes, the fruit. But don't put him in a fruit salad. Each of your patients with indication for the dental implant, this doesn't work, okay? And CBCT guided surgery need appropriate therapy, will be depend of your clinical experience, what you read, what you listen to, and especially who do you trust. Thank you. Thank you so much. Il capitano. Thank you so much.